This topic is type 2 diabetes mellitus. Let's take a second and review a little bit of pathophysiology. In type 2 diabetes, the body is either not making enough insulin or the insulin is not working properly, or a combination of both. It's important to remember that in type 2 diabetes, the pancreas is still making some insulin. This is a major difference between type 1 diabetes and type 2 diabetes. In type 1, the pancreas does not make any insulin. You can see in this illustration all the different parts of the body that are affected and involved in type 2 diabetes. There are a number of metabolic abnormalities that contribute to type 2 diabetes. Number 1 is insulin resistance. This is either the insulin receptors aren't working properly, or there's not enough of them, or a combination of both. So as that glucose is going through the bloodstream, the insulin is not able to take that glucose into the cells. So the glucose remains in the bloodstream, leading to hyperglycemia. Normally, the pancreatic beta cells are able to respond to this hyperglycemic state and release more insulin. The pancreas will continue to do that, but eventually, the beta cells of the pancreas become too tired and can't keep up with it. Another abnormality is the liver. The liver responds to the amount of glucose in the blood and will either release more or release less. The liver in type 2 diabetes is a little confused, and it doesn't know if it should release more or less, and generally releases too much glucose. Adipose tissue releases a certain type of cytokine, which will cause chronic inflammation and is linked to type 2 diabetes. Risk factors for type 2 diabetes can be categorized as what I can't change and what I can change. The what I can't changes are the non-modifiable ones: age above 45, family history, and then a history of diabetes that came upon during pregnancy. Modifiable risk factors, or the things I can change, are overweight or obesity, physical inactivity, and hyperlipidemia. These first three result in more adipose tissue or fat cells in the body. And we just learned in the pathophysiology that that is linked to inflammation and type 2 diabetes. Hypertension, which affects the brain and the heart, also affects the pancreas. That vasoconstriction decreases perfusion to the pancreas, and the pancreas isn't able to function normally. Cigarette smoking also causes inflammation and vasoconstriction, again damaging the pancreas. What are the clinical manifestations for type 2 diabetes? Generally speaking, this is a gradual onset, and many clients have asymptomatic hyperglycemia. These clients will go for years without knowing they even have type 2 diabetes. This results in having years and years of your body in a hyperglycemic state. Eventually, the client's body may respond with the 3 Ps. These are those classic symptoms of diabetes mellitus: polyuria, excessive urination; polydipsia, excessive thirst, and those are caused because that blood has so much glucose in it. So that hyperglycemic state causes an osmotic gradient. That water is pulled into that bloodstream, and then the client gets more thirsty and the client has to excrete it. Polyuria and polydipsia. Polyphagia is that insatiable hunger. So now that blood is going, that glucose is here, it tries to get across and feed energy to those cells, but it's not able to do that, so those cells are hungry. And blurry vision. Again, this is due to that hyperglycemic state. The blood, with all of that glucose, gets into the eyes, causes damage to the lenses of the eyes, and creates a cataract-like situation. Oftentimes, clients who are asymptomatic will end up coming into the clinic or the hospital with something completely different, and then blood tests are done, and it's found out that they have type 2 diabetes. That diagnostic criteria includes a hemoglobin A1C above or equal to 6.5%. Now remember that A1C gives us a really good look at an average over 3 months of what that client's blood glucose levels were. So if they were asymptomatic, we might be able to see that they've been hyperglycemic for the past 3 months. Another criteria would be fasting glucose above or equal to 120 milligrams per deciliter. Now, the client should be taking this exam when they haven't had anything to eat or drink for 8 hours. We would assume that their glucose levels would be lower. They haven't been putting any sugars or any food into their body. A random glucose of above 200 milligrams per deciliter and hyperglycemia symptoms are another criteria. So this blood might be taken after a client has already eaten. So we would expect that their blood sugar level might be a little bit elevated. That's why this one has to include those hyperglycemic symptoms: polyuria, polyphagia, polydipsia. Then there's also an oral glucose tolerance test for pregnant clients. Complications of type 2 diabetes occur because of that chronic hyperglycemia. Those blood vessels are damaged because they might have had hyperglycemia for years. Some of these complications can be avoided with diligent self-care, but some of these complications can also be exacerbated by other risk factors, like hyperlipidemia or hypertension. The macrovascular complications occur on those large and medium blood vessels. Atherosclerosis happens earlier for these clients. Coronary artery disease can happen because of the atherosclerosis of the coronary arteries. A stroke or TIA because of atherosclerosis of the cerebral vessels. Peripheral artery disease because of atherosclerosis in those large leg veins and large vessels. Then microvascular complications. Those are those small blood vessels that are affected by that long-term hyperglycemia. Peripheral neuropathies. This happens because the blood is unable to get through to those small blood vessels feeding the nerves. Clients will have sensory neuropathies where they can't feel in their feet and toes. Retinopathy. Again, this is because blood can't reach those very small vessels in the retinas. And nephropathy. This is due to damage to those small kidney vessels. The blood is unable to pass through, resulting in kidney problems and eventual kidney failure. These clients also have delayed wound healing. If no perfusion is getting to that wound, it can't heal. These clients also have recurrent infections. Bacteria and fungus love glucose. So these clients with their hyperglycemic state are a host for these infections. These clients are also at risk for hyperosmolar hyperglycemic state. Hyperosmolar hyperglycemic state. This is a life-threatening complication to a client with type 2 diabetes. Now remember that pancreas is making enough insulin to make sure that it doesn't develop into diabetic ketoacidosis and no ketones are seen, but the pancreas isn't making enough insulin to prevent severe hyperglycemia. And this leads to severe dehydration and really concentrated blood. The name says it all: hyperosmolar hyperglycemic state. That concentrated blood causes that water to be drawn out of the cells and results in severe dehydration. It is a gradual onset. The client will come in and have blood glucose levels above 600 milligrams per deciliter. This is normally caused by an underlying infection or medication, an acute illness, or a chronic illness. Due to that hyperglycemic state, the water is drawn out of the cells and goes to be excreted. So, severe polyuria, which results in severe dehydration. There will be neurological manifestations because of that hypoosmolar blood. It goes up into the brain and it'll cause lethargy, altered level of consciousness, and also coma. The client will also experience blurry vision, again, because of that hyperglycemic state, affecting those lenses and then becoming blurry. The goal of treatment for this is to return that client back to blood glucose levels within normal limits. This is done with IV fluids, IV insulin, and also electrolyte replacement. Nursing interventions. We need to teach this client about their diabetes, about managing it, self-care, and also preventing complications. Along with that teaching, we'll teach them how to do blood glucose self-monitoring. All glucometers are a little bit different, but they all pretty much function the same way. We're going to have the client gather their supplies and wash their hands thoroughly and dry their hands thoroughly. They'll turn on the glucometer and insert the test strip. Then the client will prick the side of their finger. We suggest using the side because it's a little bit less painful for the client. Then they'll place a droplet of blood on the test strip. The glucometer will work and give you a reading, and then the client can record those readings. Chronic management for clients with type 2 diabetes includes lifestyle modifications. Moderate activity. If a client engages in moderate activity, this will decrease insulin resistance, decrease blood pressure, decrease triglycerides and cholesterol, and it'll help with circulation. These are all things we want for this client. We will also encourage a diet that is low in fat, high in fiber, and also low on the glycemic index. If the client is obese, we will encourage weight loss. We will also encourage avoiding alcohol. If these lifestyle modifications are not resulting in management of blood glucose levels, the client might be prescribed oral anti-diabetic medications. If that is not working, then they might be prescribed insulin therapy. The client will also want to treat their hyperlipidemia. This will help prevent complications, and they're normally prescribed statins. We'll also want to tell the client to monitor for hyperglycemia and that hyperosmolar hyperglycemic state. Proper foot care for this client is very, very important. Remember, those sensory neuropathies might cause the client not to be able to even feel if they get a cut or injury on their foot. So we're going to want to encourage them to inspect their feet daily and report any infections immediately. They should wear protective shoes, no open-toe sandals. They should make sure they separate overlapping toes. We don't want that skin rubbing on each other because it might cause skin breakdown. And then we're going to encourage them to wash their feet daily with lukewarm water. Lukewarm water. That's important because, again, with those neuropathies, they might not know if the water is too hot or too cold and causing them any sort of breakdown on that skin. We're going to want to teach them to avoid heating pads. Again, with those neuropathies, they don't know if that pad is hurting them or burning them. We'll want to teach the client about sick day management. This is really important. A lot of clients with type 2 diabetes will say, "Oh, I don't feel well and I didn't eat much, I won't take my insulin." Well, no, illness can cause a client to become hyperglycemic. So we're going to want to teach the client that you should continue your insulin as directed and monitor your blood glucose frequently. We're going to want to encourage the client to do routine eye exams. This is for screening and monitoring for retinopathy. Also, we'll want to teach them stress reduction techniques. Again, stress can cause the client to become hyperglycemic. And then we're going to want to prevent infections. We know with vascular insufficiencies, perfusion is not getting down to those feet, so those areas that have wounds are not going to be able to heal. Also, we'll want to encourage prevention of systemic infections. We'll want to encourage these clients to receive annual vaccinations. Diet goals for a client with type 2 diabetes will help that client maintain proper blood glucose levels, maintain a healthy weight, and prevent complications. The client's diet should include foods that are high fiber, soluble and insoluble, low fat, and a low glycemic index so as not to spike that blood sugar after they've eaten. Their diet should reflect the illustration seen here. This is a great way to teach clients how to manage a healthy diet. We want to encourage non-starchy vegetables. These can be raw or canned. We want to encourage grains, but we want to encourage high fiber grains and beans. Proteins should be lean proteins. chicken and fish. And we want to make sure that we bake it or broil it, not that we fry it, to avoid that fat. And then any fruit that is eaten, we want to have it eaten in its natural state. We don't want any fruit in that sugary syrup, and we also want to avoid fruit juices, which are very high in sugar. Dairy choices should be low fat or no fat.